gotta get a shot spot.
Moi, on va aller. Bon, il faut ça, nous disons que tu vas pas là. Take a picture?
Movie. Okay, so Dr. Ed Rowland and Chris Bryan. Good morning, guys. We are on the 5th day of our trip here in Haiti, in Milot. And just tell me a little bit about your experiences and what you've seen and how you felt about it.
Sure. Many of the patients were in the phase of treatment are about 6 weeks out from the quake. Many of the procedures we're doing are infections and making decisions about getting external fixers off to kind of transition people back to ambulation and functioning.
Can you guys use a little bit more layman terms for me when you're talking X-Fix and the ambulation and stuff?
In the early stage of the earthquake victims, as they were pulled from the rubble, they had open fractures and limbs that just needed stabilization. With open wounds, you can't put that into a cast because the wound will be covered and hidden and it'll get infected. So they put pins in the bones above and below the break and then connect a rod on the outside of the bone. And those devices will do very well in the short run, but they're not really something that you can use to take the bone all the way to heal. So what we're doing now is 6-7 weeks into it, taking those off now that wounds are manageable and converting over to casts or other types of fixation.
And were you guys, how did you feel about when you came down here? Were you prepared for what you saw?
I don't think you can prepare ahead of time. We had an idea of what we would be taking care of, and most of that has met our expectations based on the timing of when the injuries occurred. But there still is, life still goes on. There are car accidents and people fall out of trees, and there are orthopedic injuries that are happening concurrently. So it's not as if life has stopped here. There's still other folks that are in the hospital and in the area being taken care of, and we've been able to assist even the Haitian physicians on new injuries. The overwhelming amount of care that needs to be done now is rehabilitation, physical therapy, and really mobilizing these patients so that they can get back to some level of function.
How about the condition?
Yeah, I don't think I was quite prepared. I don't think images do the place justice in terms of understanding what's really going on here. The lack of cleanliness, the poor situation we're dealing with in the operating rooms. You hear coming down here that this is a functioning hospital, undamaged by the earthquake. But functioning here in Haiti is far different than functioning anywhere in the United States, and it's really quite eye-opening to see what they're actually doing in terms of a building they call a hospital, an OR they call an operating room. It's pretty impressive.
I think what Dr. Rowland's trying to say is that although there's a building and a roof and it doesn't leak when it rains, as far as we can tell, there aren't the amenities in terms of sterility and sterile technique. It's sort of they're clean rooms, but even the scrub sinks for the doctors are minimal, and just although the pictures may show modern equipment inside there may not be connections, and they may not have all of the treatment tools and options that we have in the States. So we have to get creative sometimes at putting things together. And being that we don't know what are in the sets where the instrumentation and screws and plates are, we have to open those up to inspect them before we can use them, because you can't be surprised in the operating room. And then for them to go through the sterilization, it takes 3 hours. So it requires a lot of planning on our part to take care of some of the fractures and some of the injuries.
What's been the response of the Haitian people to you guys?
Oh, it's very impressive. They're very thankful. To give you an idea of how thankful, even when we're in a situation where we have to do something that's quite painful for them, and they'll shriek and cry, and as soon as we're done, they're thanking us, even though we just caused them pain. So they're obviously very appreciative.
I think as you go through the pediatric ward, that really does pull the strings to your heart there. Just the children with amputations or injuries are still smiling and playing. They're still children, and one of the things they do is dance and have just delightful smiles, and just to observe their joy and happiness and just being children is quite remarkable, given the devastation and injuries that were sustained.
And finally, what's been the highlight of the trip so far?
That's a good question. Yeah. The thing that'll stick with me most was something Chris talked about earlier, that life goes on here in Haiti. And we came down here to treat earthquake victims, but as we're here, they take advantage of our presence, and they'll bring in anything they have that they even can think it's even remotely orthopedic and want our advice. And the patient we had, it was an elderly woman who just fell and broke her hip, something very routine in the States. The ordeal it was to get that repaired, something that would take an hour at best, was several days in the making, actually. So that experience is going to stick with me.
I think the experience that will stick with me is the image of even our team taking patients in and out of the operating room. It's not like we can wheel them into the OR. There's several corners you have to go around, and mosquito netting you have to go through to get into the operating room. And then the little litters, they're like the military uses to move soldiers on and off of the ambulances and whatnot. The image that will stand in my mind is how our team, or the surgical team, had to carry the patient out of the hospital, across a dirt road, down an embankment with gravel, and back into a very large military tent, which has been made into essentially a ward that's loaded with 40 to 45 patients. And so that image will stand with me as well.
We'll just ask her and see what she says.
Julie. We got the bleachers set up to watch.
And one more time, you're gonna make your face like Ready? Thank you very much.
You know, you guys have helped us like in so many ways. Like, okay, you know, you left your family behind, your job behind, and basically to come and help. And what's most important, you guys leave something behind. What is that? Your skill. Like, you pass on the skill, so we could like help, you know, our people, our community. And we say thank you for that. You know what I'm saying? We say thank you. We appreciate you guys so much.
Yeah.
Yes.